I think we are ready to start. First of all, I would like to thank you so much, Brian, to be here on the first APAMTC talk. Okay, thank you so much.
Thank you
For your time, and we have the opportunity to meet on last September at BHC Symposium. You did an amazing lecture on understanding and treating menopause, hot flushes, and allow people to understand the dynamic of Chinese medicine, and that's what we will go around today on an open talk, easy way. Everyone can ask, write the questions on chat. If you want to make it on voice, you just raise your hand. We will allow you to make it. I will able you to do that. Then I will just give some words in Portuguese, Brian, okay? Just to show what we want. A APAMTC Talks é uma iniciativa que pretende aumentar a interação entre a comunidade, que nos permita a todos, enquanto sociedade, melhorar, crescer e desenvolver a medicina chinesa, tanto como medicina tradicional chinesa, como acupuntura ou fitoterapia, ok? E precisamos, para isso, que haja participação das pessoas que nos ajudem a atingir esses objetivos, e vamos trazer autores de livros e palestrantes internacionais, como no caso concreto hoje, com o Brian. Ok? Sem perdermos mais tempo, as sessões terão no máximo 45 minutos, e hoje estamos a falar com o autor do livro Understanding and Treating Hot Flashes in Menopause with Chinese Medicine. Brian, welcome. We will start. You are a very dedicated man on TCM, and I will start to read a short bio of you that you provide me. And Dr. Brian Grosam earned a PhD in acupuncture in 2009 from Shandong University of Traditional Chinese Medicine, where he fulfilled clinical studies in gynecology and neurology. Upon completion of PhD, he became a professor at the American Academy of Acupuncture and Oriental Medicine, where he taught acupuncture from 2008 to 2015. Brian is the author of Understanding and Treating Hot Flushes in Menopause with Chinese Medicine, the first book in history to be written on the subject. His book combines Chinese medicine concepts with current Western medicine frameworks of science for contemporary treatment approach to hot flushes. He has written several articles, is a renowned international lecturer at medical symposiums, and has taught online continuing education courses on a range of subjects, including hot flushes, menopause transition, etc. Brian Guzman is a member of American Board of Oriental Reproductive Medicine and a diplomate of Chinese medicine from NCCOM, the National Certification Community of Acupuncture and Oriental Medicine, and is also a member of a North American Menopause Society. Welcome, Brian.
Thank you for having me.
It was a pleasure. So,
thank you.
My first question will be, after the journey you start, why pick up hot flushes and menopause issues?
So when I was in China and I was deciding what to research for my PhD, my professor did some preliminary scientific research on ear acupuncture for treating menopause. And so he asked me if I wanted to continue research on menopause. So I did a year's worth of research. I selected a standard acupuncture prescription and treated 40 some ladies for 12 weeks, and it showed good results. But after my dissertation and my PhD studies were finished, I went back into my own personal practice and I wanted to know more about menopause, and more particularly hot flashes in Chinese medicine. What causes them? What's the root cause of the heat and the hot flashes? So I spent the next 15 years treating women in my clinic and taking notes and doing my own clinical research. And my book is the accumulation of my last 15 years of work.
Yeah, we can saw it when we read this kind of book, and I will just share with you all guys the image for you to know what are the book we are talking about. Okay, this is the cover we should buy if it's okay. So the idea here, oh, I have to mute someone, sorry. Mute here. Oh, sorry. Yeah, it's okay. Now we can proceed. So after you have that experience, and obviously Chinese medicine can support women all during their all phases of life, but in menopause it's very important. Can we really summarize the way how the hot flashes came on Chinese medicine perspective?
Well, there's if you go through the scientific research route, it's very slow and it takes a lot of patience and it takes a lot of time and money. But some of the science is backing the efficacy for treating hot flashes. But my clinical research shows that we can have a significant impact on treating hot flashes by minimizing them and even shortening the duration of how severe the symptoms are for women.
Yeah, and sometimes they are very hard to manage, right? People sometimes find us.
Yeah. As you know, the people that find you in clinic oftentimes are the most severe and the most desperate people. The easy cases, they don't often make it through your doors, but we're the stronghold for helping people with severe and chronic issues.
Mm-hmm. We set some questions, and one of those were, do you have any particular idea what is the mean of the age, the people that finds with the severe of hot flashes? Do you find any idea at the age the people have, the patient have? Do you have any idea about it? Average? Or it depends? Ainda estão aí os outros, não estão? Tivemos aqui só um problema de rede, ok? Aqui com o Brian.
É, só com ele.
Ok.
Estamos.
Okay. Que ele tinha comentado que eventualmente ou ocasionalmente na geografia onde ele está que isto acontece. Portanto, é sempre um risco. Aqui fazemos online, ele vai voltar. Alguma pergunta, não hesitem, está bem? Escrever no nosso chat para que possamos fazer a pergunta. Ele, penso que em breve voltará, se tudo correr bem. Aqui está de volta. There we go again.
Can you hear me?
Yeah, now we can hear you. Yeah.
Sorry about that. So let's see, where was I? So what we really want to focus on is women in their 40s. That's the transitional period when the menstrual cycle can become irregular, sleep emotional issues, genital issues can start becoming increasingly maybe erratic or something like that. So the biggest takeaway I can offer everyone listening is you really can help women into menopausal transition and help them by empowering them and not letting the symptoms get out of control. Does that make sense?
It's a very important perspective in the sense of preventive aspect of the transition, because menopause is not a disease, as you said in your book. So, and we have a question from Sonia. She has raised the hand, so it's nice to have this kind of interaction. That's what we want. Sonia, go ahead.
Hello. I started specializing in women's health last year, and I've had many women with menopause here, and I feel that they really fall out of the norm that we think it's kidney yin deficiency or liver yin deficiency, and often even a lot to do with the heart, blood, or even spleen deficiency. And I wanted to ask you, is it then that you say it would be best to start treating women without starting to show signs in their 40s so that they don't fall into the disharmony pattern later? Would that be a recommendation to clients? Because often, as you say, they come with really difficult patterns and sometimes really difficult to control it with herbs and acupuncture very effectively.
That's very true. Once the symptoms become severe, it's more difficult to get them under control. So trying to reach the public and treat your patients at a younger age, you can help with that smoother transition. You raise a very interesting point. The classic books on menopause, talking about yin deficiency is completely outdated in my perspective. In this modern world, more women need to be nourished, their chi and their blood. I think if you read my book, you'll understand that by nourishing the chi and blood, you'll have a greater success, because our modern lifestyle really depletes that. And after all, decades of a menstrual period really takes its toll on the overall blood of the body.
Thank you so much, Sonia, for your participation.
Thank you.
Yeah. And according with your question, we will fall in the next one. That's on Brian's book. We can read that the lung is related with breath and activity. And then we can find that the kidney is related with the work and rest, and the spleen about diet and nutrition. And in modern societies, maybe it's the reason why we have this kind of new pattern, or it's not the trend pattern on yin deficiency. Brian, can you allow us to understand your perspective on the lung relation with the kidney and the breath, please?
Okay, yeah. So when any patient comes into my clinic, I immediately think about how are they making new, fresh chi and blood. And that comes from the lungs, the spleen, and the kidneys. If those are not working, if they're not in harmony, then you're just trying to supplement something that's not working. It's like the machine isn't working very well. And at the core of those three organs is the connection between the lung and the kidney. And that has the most basic relationship of breath, right? On the inhalation, the kidney grasps the chi from the lungs, and on exhalation, the kidney chi rises up through the spleen back to the lung, and that whole process generates fresh chi, and then it's made into blood, and then it's spread out through the entire channel system and to all the organs. So there's a classic saying in the Nanjing in chapter 11 that over time, as we age, it becomes increasingly easier for the lung and kidney to become disconnected. And I believe in modern society, a lot of that has to do with the stressors that we have. And with our stress and our anxieties and all the pressures that we have to deal with, that becomes even more prominent, where the liver becomes overactive and the diaphragm becomes stuck, and then our breath can no longer descend to the kidneys. So what Sonia was pointing out earlier about kidney insufficiency, of course, we always have to nourish the kidneys as we age, but it's like trying to give nourishment to the kidneys when the kidneys are disconnected from the rest of the organ system, when in fact the best thing we can do is to regulate the qi and reestablish the connection between the lung and the kidneys. So when patients come into your clinic and they're breathing into their chest, perhaps, or you can ask them about their exercise and activity habits, or if they meditate, you need to, actually effectively show them how to reestablish their breath. And there's a number of ways of doing that: yoga, chanting mantras, exercise, jogging, all that kind of stuff. But when you can get your patient on the table and you put your hand on their abdomen and tell them to breathe into your hand, you can begin to open up that disconnect and reestablish that. And that's half the battle in the clinic, is to make sure that all the organs are communicating properly.
Yeah, thank you. So their question, and Sonia has another first question. Go ahead, Sonia.
I have another question. So normally we diagnose by not only pulse and tongue, but also symptomatology. So when patients don't really show any symptoms of lung deficiency or disconnection, where do we go from? Is it by really, because we ask, do you feel oppression? Do you have difficulty breathing deeply? If they don't have any of this, how do we really find out that there is an imbalance?
Well, okay, so yeah, it's not always going to be the lung and the kidney. That's just one. That's just one. And then I kind of go down after that. The other thing that I really concentrate on is the digestion. Do they have any digestive issues? Do they have any reflux, any stagnation in their stomach? Do they have any stomach issues, bloating, pain, gas, and if their stools are irregular? And then ask them about their eating habits, the no appetite or hunger and all that kind of stuff. The digestion, it's paramount that conduit, the yang ming in particular, is flowing downwards. So that relates back to the Shanghan Lun, where yang ming excess, if it can't descend, then Chao Ro, or tidal fever or tidal heat effusion, arises. So we can eliminate that too. And from there, where else do I think about? You think about if they're overextending themselves by overworking too much, if they lead a sedentary lifestyle, if they're sleeping enough. These are some really basic things that will give us clues as to where the imbalances are. And I know exactly what you're saying, because a lot of times patients will come in and their tongue and pulses won't reveal too much.
Not always, no.
What's that?
Not always. It's sometimes quite tricky with menopause because it's so confusing at the end. Sometimes it's difficult to find a root. And you were saying that often is lung and kidney connection, which I didn't really find too much, honestly, myself, but maybe I'm not too detailed.
Mm-hmm.
I don't know.
Yeah. I don't want you to think that that's the complete scenario. But I want you to consider the idea that the lung qi goes down and then the kidney qi comes back up, but that also plays in part where the spleen qi is rising, And the liver we know is the basis of blood. It, you know, it houses the blood and it controls both yin and yang. So a lot of issues with menopause can happen in the liver without there ever being any really true signs. For example, liver fire, or blood heat is a real issue in menopause, but it doesn't necessarily show, because we always think blood heat is like there's bleeding or there's a red tongue or there's a rapid pulse, when in fact the liver can become overheated on top of spleen deficiency. Spleen, heart, and kidney, they're all weak. So the patient comes in, they have a weak pulse and they have a pale tongue, but they have these heat signs. And where's that coming from? And sometimes it's an overheated liver, and which is a little bit more difficult to diagnose. But that will sometimes show in the in patients who are A-type personalities, who are overworking, can't relax, high anxiety, insomnia, and stuff like that. Sometimes they would benefit from cooling the blood or cooling the liver.
That's a good answer. Then we will need to go a little bit further, in the sense of even on your book, we can really read perspective of work and rest to support the kidney, as you are saying now, and how the stress and emotions can imbalance liver, as you know, on TCM practice. And then you said the childhood, in the sense of the development internally, can happen. Can you allow us to understand the strategies to control a little bit on more detail with herbal strategy, for instance, how we can control a little bit of the tidal fever in that sense of Changhun?
So let's say there's 5 pieces to the puzzle. There's 5 organs, right? And each of these 5 main patterns, and I know that there's more. I usually look at about 8 or 9 causes for like hot flashes and dysfunction for menopausal transition. But if we start with the spleen, from the Pi Wei Lun, or the Treatise of the Spleen and Stomach, and Li Dongyuan talks about how spleen deficiency, when it's deficient, can generate dampness, and the dampness will pour downwards, and it can pour downwards in between the kidneys and disturb the ministerial fire, which then can give rise to yin fire. So a lot of these, some of the patients you'll have come in will have spleen deficiency signs, but they'll also have heat signs, and it'll look a lot like kidney deficiency. Like the traditional kidney yin deficiency, but it's like, how can this person be kidney yin deficiency when they're showing more qi deficiency and stuff? And so that's when these patients have weak spleens. They usually have inadequate diets and lead sedentary lifestyles. So the proper treatment with that would be a kidney, or a qi tonic called Bujangyi Qi Tong. And then you'd actually have to supplement the qi with acupuncture, but you also have to drain dampness and drain heat. But if we take a step over then to, let's just address the kidneys. I always address the kidneys with acupuncture. I'm always needling Ren 4. I'm always needling kidney 3. I often use 2 points on the kidney channel. I'll use kidney 3 and I'll use kidney 2. Kidney 2 is my favorite point for hot flashes, by the way. And then maybe even kidney 1. So I'm always needling kidney. I'm always supporting the kidney, but I'm not necessarily focusing on the kidney per se with herbs. I find that kidney tonics are less useful for menopausal transition until women become later in their 50s and into their 60s. But beforehand, focusing on qi and blood tonics, like bujang ichi tang, like I mentioned. I also like using, you'll have a lot of women with heart issues. And it's not really that they have, in Chinese medicine, it's not that there's anything wrong with the heart, but the heart gets all of its qi and blood from the spleen. It gets its balance from the kidneys, and it's balanced by the liver. So in clinic, I'm really focusing on looking at more or less the spleen and the liver, that balance between the wood and the earth on how they supply the heart. So the spleen needs to supply the qi and blood, and like a formula like guipitang is fantastic for women who are having anxiety and sleep problems. But then again, if it's more or less the liver becoming too hot, or there's too much yin and yang imbalance, where it seems like the yin is deficient and the yang is rising, I'll usually use a formula for cooling the liver, like long dan xie tang or something like that. So playing around with looking at, I tend to look at rectifying the upward movement of fire and yang energy and qi with the liver and the spleen, but you also need to anchor it by nourishing the liver, spleen, and kidney. Does that make sense?
Yeah.
It's a lot to take on.
It makes completely sense, and we are on the same page for sure. And Sonia has another question. I will just lower your hand and you go ahead.
Yes, I had a case, like you said, with very severe spleen deficiency, but then the rebellious qi upwards. And I started to work on the kidneys, but then eventually I thought, okay, I should really rise spleen qi and increase blood production. And I tried the Buzong, but then eventually I find that the hot flushes were getting better previously, but then got worse again through the hot herbs in the formula. So I really find it difficult in doing that with nourishing with warmer herbs to not damage and make worse the hot flushes.
It can be tricky too, and it's subtle, but as you're treating hot flashes, the patient will slowly change from deficiency to excess, very subtly, almost like through the months of a menstrual cycle. So sometimes I've done that where I'll be using a formula and things will be working pretty well, and then I'll switch over to another formula, and then I'll come back around to the old formula later.
Okay, so it's really giving one and then the other in smaller quantities and the other again and switching over and so on.
Yeah, it's the reasoning behind this, what I think is that it's the disruption. It's more of a Western scientific disruption where the ovarian reserve is depleting and there's less estrogen communicating with the hypothalamus. So the hypothalamus, which controls the thermal regulation of the body, sometimes that becomes a little erratic, and a lot of things can throw that off. And it's my belief too that to translate it back into Chinese medicine, it is a yin and yang imbalance, but it's kind of like it's kind of, yeah, it's like the cycle of the menstrual cycle. So you have yin times and you have yang times. During the day, there's yin times and there's yang times. I've had patients where they'll respond better to nourishing in the morning versus the evening, or they'll have better luck sedating in the morning versus the evening, or front treatments versus back treatments at different times of the day. So it's quite interesting how the body responds from week to week and month to month, and we will be treating these women for several years. If they continue to come in, they do change.
And many women are on HRT, huh? Even extra on that also.
Mm-hmm. Yeah, I've you'll see, and I'm not sure what it's like there, but in the States, there's some women are still taking it.
Yes. How long would you say does it take for you to achieve an satisfactory balance in the average client of hot flushes? Would you say months? Months, no? They need to be months.
So
Sometimes.
yeah, what is our goal? So it's like my understanding is that we want to get the severity down to an acceptable range when the patient can live a normal life. So is that like taking the hot flashes down to zero? Or any of the symptoms of menopause down to zero? It's impossible. But we want to get it down to an acceptable, I think anything under, like on a scale of 1 to 10, anything below 3. And as you know, most patients coming in, their hot flashes are 6, 7, 8, or 9, and their anxiety and their insomnia and their fatigue, it's all way high. But you can actually chart that and ask people, from week to week, how severe are your hot flashes? Let's just use that as our model. And they'll first come in and it'll be a 7 out of 10. And then, so to get it down to where it's acceptable, whether it's 3, 2, 1, or 0. So I usually look at people, at my patients, and say, is it a mild case? Is it a moderate case? Or is it a severe case? Mild cases in general will respond within 6 treatments. Moderate cases, 6 to 12 treatments, and severe, 12 or more. And that's based on 1 treatment a week. If they can come in twice a week, it'll help you gain control of some of the symptoms faster. But a lot, as you know, I don't know what it's like in Portugal, but in the United States, a lot of times with the busy lifestyle or finances, they can only afford or the time or money to come in once a week.
Yeah, almost the same. The majority of the scenario could be that, but we are here to promote a different perspective, how people can use Chinese medicine to balance themselves. And that's why we are setting APAMTC Talks, not just for practitioners, but for our Portuguese society, understand the benefits of the use of Chinese medicine in Portugal. And to continue our talk, I will share with you guys one sentence that you did on the BXC conference. That was the most important thing to do with menopause woman, and you didn't say that is the disease of menopause. So it's a way to approach that phase of life of the woman. So when you go, this is a question, when you go on 50 and 60s, maybe the yin is more depleted. That's the reason why we may go a little bit on the classical yin deficiency syndrome. What's your take? You think it's about the age, or it's about the exhaustion of the heat, the syndrome that comes during the time?
I'm trying to make trying to make sense out of the question, and how I would like to answer. So it's interesting when you start getting to know your patients and you're practicing for some time in the clinic, you'll start to get to notice several of the women coming in. A lot of the women are at a crossroads in their life, and they're scared, and maybe they're maybe they're in a job they don't like, or maybe they're in a relationship that's frustrating, maybe their children left, maybe they're having financial difficulties, all sorts of different reasons, and they're scared. And I think the number one thing that I approach, and I'm not saying every woman is like this, but I think the word transition, for menopausal transition, is it strikes me as part of the key. As we read in the Yellow Emperor's Internal Classic in the first chapter, how females age at increments of 7 years. So that comes up at age 49. And then I wonder, well, what happens after that? You know, does the cycle start all over again? And why did they stop at 49? And what happens after that? And I know it's in the short sense, it's all about the menstrual cycle. You know, at age 49, then, you know, the menstrual cycle is done and ends from there. But that also ties into culture and society archetypes about women and their roles in life in general. And in a lot of societies, and let's just take some of the places around the world where women don't really experience hot flashes or very menopausal symptoms, and they're often in smaller cultures where women are revered as elders and they're well respected, and they don't have the same stressors in general that some of the bigger countries and cities experience. And there's been a lot of patients, and I'm getting to your question, there's a lot of patients where when you can help them see their importance and have them connect to their importance and their empowerment, and see hope, I believe that is one of the magical keys that we can do without herbs or acupuncture in the clinic, is giving them the space to realize that they're more important than they even realized, and that the second half of their life is going to be amazing. So with the idea of Jing, that kind of goes all the way back to, I mean, so many people, it's just like our medicine, if you take it word for word, it's just like you just run out of Jing and then you die, right? Or even Western science, your body after the age of 30, it's slowly deteriorating. But we know through breathing and through Qigong and through longevity ideas and concepts, we can expand that. And I do believe that transition for women, and I don't know how to explain it in men, but in women, that transition, that body is reestablishing for the next 50 years. And it's almost a crossroads. We can be advocates for our patients to another 50 years of improving the health or just of decline.
Yeah, the idea you show up all over your book is about keep what is the phase you are living, the Yang strategies allow people to have better nutrition, good exercises, breath exercises, and there is a very quite interesting sentence, and maybe we have to finish in a few minutes too. But there is a sentence in your book on page 185, and we can read, "It's necessary to take a close look to the resolving behind the necessity to remove the uterus and the ovaries." Can you elaborate a little bit on this? Because there is a lot of hot flashes can be induced by surgical or by chemistry. And I would like to finish with that, because Chinese medicine, I think, can support a lot of patients that live on oncology or with other symptoms. Go ahead, Mark. Thank you.
So yeah, that's really important. I'm just kind of shifting over into science, right?
Yeah.
So surgery, full hysterectomies, when the ovaries are removed, induce immediate hot flashes. Women who are on estrogen blockers like tamoxifen or something like that, that increases hot flashes or can start hot flashes, and different pharmaceuticals and things like that. So how do we help with that? The best advice I can say is the best results I've had in clinic is starting as early as possible. And the longer it goes, the longer a woman is on tamoxifen, or let's say even thyroid medications, levothyroxine, or the longer it's been since the hot flashes started from the full hysterectomy, the longer the time, the more difficulty it is to control, because the neuroendocrine system has a new learned behavior. And I use that a little loosely, but it's true. The neurotransmitters of the brain start following a new pattern, and it's more difficult to hack that, to reestablish a new, or to establish a balance when the body is in such disarray.
That's a good way to approach, and that's why preventive medicine is about Chinese medicine, right? That's the way we want to show too, because once we go earlier, we may go better and longer. That's a good way to put it.
Yeah, that is. Yeah.
At least it makes you smile, and it's a good thing. The sentence. So, anyone have other questions to present to Brian? If someone have one, please do it now, because we may have to finish. And Sonia, go ahead if you have another one.
I will do my last question. If you use a lot the Chongmai when treating hot flushes.
Oh my gosh, that's a tricky question, because the Chongmai has so many different relationships. It has a relationship with, the ren and the du. It has its it's, after all, it's blood, right? And from my understanding, with the decline of the Chong and the ren, based on the Huangdi Neijing, it's basically talking about the decline of the kidneys. But as we know, the kidney essence is the foundation of the blood, and the Chongmai is the sea of blood. And that's why I often focus more on making sure that the blood is nourished, and if it's overabundance, then it gets hot. But I more or less balance the yin and yang within the blood than looking at balancing yin and yang and then blood separate, or balancing the Chongmai separate.
Yes, because the Chongmai often is used as, or I try to use it with the idea of controlling counterflow chi.
Mm-hmm.
And hot flash can be seen as a counterflow of chi, no? It's an uprising energy. No?
Yeah, I'm not quite certain that is the prime idea of hot flashes. I think that plays it plays a part of a smaller portion of hot flashes, but I tend to think that more of the hot flashes is more chi than in relation to counterflow chi.
Okay, thank you.
You're welcome.
So thank you, Sonia, for your participation. It's the way we want our members to approach our guests. Thank you so much for doing that. And just to finish our record, I would like to give applause to online staff for Brian, and was really a pleasure. And I will say thank you again for your willingness to participate in our first APAMTC Talks, and I believe it was a great start. Thank you.
Thank you very much, Pedro, for inviting me. It's been a pleasure. I love talking hot flashes. That's all I think about. And if anyone has any questions, please share my email and you can ask any questions that you want.
Yeah, we will do that for sure. And just to promote our international connections and the Rising Together project, you will be in Austria in September, and we'll be in Dublin in October, if I'm correct. Right?
Right.
So those
exactly.
those congresses are about our community and the way we want to raise together. Thank you, Brian, for your time.